In this video, we're going to discuss how to add, edit a patient's case. In Katana, any patient that needs to be seen for treatment or would like to purchase anything in the office must have a case. If the patient does not have a case, you will not be able to schedule the patient, take any payments from the patient, upload any kind of documents, add any insurance information, as all data entered is tied and organized by that specific patient's case. There are two ways to create a new case for a patient. One is within their patient file that we will be discussing now, and when scheduling a patient for their appointment. To create a new case for a patient's file, simply go to your patient's area of your Katana toolbar, select the specific patient from the Rolodex, and select the Case tab. Once you are on the Case tab, you will go ahead and select New. When creating a new case, there are three must-have areas. You must enter a case description. This follows the patient and will be displayed in their patient file. Over here to the left, it will also be displayed when scheduling the patient, when in the appointment dashboard, and within the patient's appointment when being seen. This area can be as general or as descriptive as you would like it to be. You can enter something such as chiropractic, or you can get more detailed by telling the system how many visits they get with insurance, if they're on a grandfathered rate, or if they have to provide a copay. Since this area follows the patient throughout the software, it is really helpful in knowing exactly how that patient should be treated or what kind of care they are receiving. This area is not displayed on anything. It is for the office only. Next is the case type. Katana has some default options available such as cash, Medicare, personal injury, general insurance, workers' comp, scholarship, and barter. This area can categorize your patients in a general way, such as the options listed, or you can get more detailed by selecting the little paper icon to the left and add in specific options so you can find out what primarily makes up your practice. The case type correlates with the case classification report, so that way you can see every single patient that falls under that specific case type and their revenue. In the report, it shows the number of completed appointments, how many payments have been taken, whether they were patient payments or payer payments, if there were any fee adjustments, write-offs, and the total charge amounts. So this area can be really helpful if you want to see all your patients that are maybe dealing with acute care versus wellness, or patients that fall under a specific type of insurance like Blue Cross Blue Shield. Once you have decided how you would like to classify your patients, you can go ahead and select Add to add in a new option, edit an already existing option. If maybe you don't use barter, you could take that out or just make it something different. Or if you don't want to use an area altogether, you can select it and hit delete. Once you've made your selections, go ahead and hit save, and it will tie that specific case type to this patient. The third must-have is your price list. You will go ahead and select your price list from the drop-down, indicating that this is the price list this patient is on. If you're our clinic billing insurance, you will see different red boxes indicating what area of the HCFA form that information will fall on. You will also see a messaging area if you're using the opt-in to send only messages to patients you select in your admin appointment reminders area. You would just go ahead and select the specific boxes indicating what reminders they should receive. You can tie a referring provider, and you can also list a designated provider. Selecting a designated provider means that you are designating a specific provider for this specific case. This area works a little differently than the assigned provider in the patient info tab because this provider is only tied to this specific case, allowing you to select different designated providers for different cases such as massage cases or acupuncture cases, etc. The designated provider area works in conjunction with the day sheet and collections income report, as they can both be selected to run by designated provider. If you have selected those reports to do so under Admin Global Settings, you must select a designated provider or the patient's information will fall under the unassigned category. You also have the ability to assign a billing provider. This means that no matter what charges or provider that sees this patient, everything will be billed under this specific provider. If you do not designate a billing provider, everything will default to the treating provider. The following areas below are only added in if that information applies to the specific patient, but I would like to state that right here under Release of Medical Info, box number 12 on a HCFA form, if this date is not selected, you will not pass scrubbing and you'll have to come back in later and add in this information. Now we will discuss how to add in a case for a patient when scheduling their appointment. We're now going to move over to the appointments area of your Katana toolbar. We're going to select the schedule button to bring up your appointment book. We're going to select a specific time slot, select a specific patient and hit open. You will see with the patient that I selected that a case is not displaying and there's not one in the drop-down. This means I must go to New Case up here at the top, add in my specific case description, add in my specific case type, select my price list, and add in any other necessary information that should be applied to this case and hit save. Once I have created my new case, I can go ahead and schedule this patient. If I need to edit an existing case, I'm going to move back over to my patients area of my Katana toolbar. Go ahead and double select my patient. And instead of hitting new, I'm going to hit edit. This patient was already pulled up, so it's not displaying that information. So I close them out, open them back up, and now I have the ability to select the edit button. If you selected any information improperly, you can go ahead and change it. In this case, I'm going to go ahead and change them from a cash case to a Medicare case. Once I've made my selections, I will go ahead and hit save. And this concludes the video for how to add, edit a patient's case.